I'm impressed to be here, really. And one of the things that has impressed me is the number. The number of people who have come here and the representation from what I have heard being said as speaker after speaker was speaking. We are talking about 15 counties, we are talking about other ministries, we are talking about, I think, county assembly? I can confirm that we have the county assembly, CEC finance, CEC health, CEOs, and probably directors are in this room. And from the national government, I can see so many of my team members are here from the environmental health unit. So it's great to see everybody in one room speaking about something that is going to help the people of this country, and especially the people at the bottom of the pyramid. We have not met with many of you, but for Roslyn, who I have known for a very long time. So my name is Mary Muthoni. I am the current PS for Public Health and Professional Standards. If you're a CC or a CO, you know why we say current. I was in West Pokot the other day, and the CEC health was a lady. So when he was introducing himself, I had to look back and say, Allah, what happened overnight? You know? So I want to express my sincere gratitude to each one of you for taking time to be here and participate in this 7th Kenya Sanitation Alliance quarterly review meeting. And this gathering really holds a very significant importance as it provides us with a moment to reflect on the strides that we have made. I have listened and listened so many things that you have talked about Beverly. Then when Wainaina was speaking, I could see that this has been a very solid team and the achievements have been many. So it offers this platform to engage in constructive discussion and challenges as we continue to face and, most importantly, to chart a way forward. One of the critical issues, ladies and gentlemen, that we have been addressing the prevalence of poor sanitation and hygiene practices has been identified as the leading cause of various diseases such as diarrhea, cholera, typhoid, and other waterborne illnesses. And according to the recent reports, inadequate sanitation and hygiene contribute to approximately 829,000 deaths annually. Maybe we should narrow it down to Kenya, narrow it down to each county, and narrow it down to our villages, so that we can have accurate data on what we are really trying to eradicate. And with the majority of this, they are children under 5 years. It's basically general that these children of 5 years are not even able to clean their mouth, clean their anus after going to the toilet, after defecating. They are not able to do anything. So the prevalence of disease is high, and the risk of infections is large with these children. With statistics indicating that out of every 100 patients in acute care hospitals, 15 are expected to acquire at least one such infection during their hospital stay. So it means we're not just talking about our households. It's gone also to our health facilities, because probably the interaction with the many patients here and there, you get prone to infections. In Vision 2030, Kenya aims to elevate the nation to a middle income status with a focus on providing a high standard of living for all citizens, including universal access to sanitation services. The country has further prioritized the the realization of Sustainable Development Goal 6, which aims to achieve access to adequate and equitable sanitation and hygiene for all and end open defecation by 2030. Therefore, the economic rationale for robust investment in sanitation and hygiene initiatives cannot be overstated. For every dollar allocated to these sectors, the World Health Organization estimates a return of $4 in saved healthcare costs and increased productivity. It is not just about humanitarian, it is also about smart economics. You know, when Rosalind was talking, she talked about allocation of funds, putting money together. And when we talk about local mobilization of funds, we just think about the counties putting money together. But where is the private sector in this? Where are they? Can you stand up to be counted? Raise your hand. Let us see you, that you are among us, that we are working together. Because we do not have a disease for the government, a disease for the private sector, for development partners. When these things come, they sweep all of us. Therefore, it would be important that we think through as we plan on strengthening our coordination, who are the other people that we bring on the table to ensure that we are able to achieve much more. The Constitution of Kenya, again, in the 4th schedule, has devolved most sanitation functions and services to the 47 county governments, with the national government retaining responsibility for national policy, training, capacity building, technical assistance, and standards formulation. The county governments are responsible for county sanitation services, including licensing and control of undertakings that sell food to the public, cemeteries, funeral parlors, and crematoria, refuse removal, refuse dumps, and solid waste disposal, and stormwater management in build-up areas. Clean, safe water and sanitation are not only about hygiene and disease prevention, they are about dignity too. Everyone, and that means all the people in the world, have the right to a healthy life and a life with dignity. You see, when we went through the inspection and assessment of all the health facilities, you know, it would be actually moving when you see a mother in labor and in an open, you know, an open hall, and not even a single curtain, you know, preventing any eye from seeing what is happening. Same case with issues defecation. We take it as a private affair. So when we see children run in the field, or even a grown-up being in the field, it can really be demeaning and embarrassing at the same time. One of the objectives of Kenya's environmental sanitation and hygiene policy, that is of 2016-2030, is to ensure sustainable financing for sanitation through public-private investment. And this resonates with the objectives of the Kenya Sanitation Alliance. I think I've just talked about that, I've preempted it. As more counties, because we already have 13 out of 15, the commitment is there. As more counties come on board, we should count more companies reflecting the same. Can we have a company for a county that has committed to the same, to some amount of money that is being put for sanitation? So additionally, the KSC resonates well with the Ministry of Health's endeavor to promote sanitation and hygiene to everyone in Kenya while paying attention to the vulnerable, the disadvantaged, women and girls. And the ministry considers WASH as an important public health intervention within the bottom-up economic transformation agenda for universal health coverage and a major pillar of the primary health care. And the more reason I am implored to inform you of our intended public health day that we have envisioned, that we are working on, which we will call this same team to come and discuss about it and the rollout for the same. Because in Kenya today, if you look at the many issues that are affecting us, they come through issues to do with personal hygiene, the school-going children who will go to school without even brushing their teeth, without even having handkerchiefs. Your own personal hygiene, whether it is menstrual hygiene or any other, as long as it is personalized, that it is me, then you're prone to diseases. So personal hygiene is very key. And during our public health day, that will be a key focus in every other home, every other office, institutions, from one institution to the other, whether it's private, public, or faith-based institutions. And the second one being the environmental hygiene, which touches heavily on what we are talking about. Environmental hygiene, starting from climate change issues. Remember, every third Thursday of every month is a tree planting day. Yes, it is going, and environment, climate change and health are too intertwined at the hip. You cannot separate them. Whatever that climate is giving us, whether it means the extreme weather conditions, including extreme heat or more rainfall, it comes with its own hazards. Therefore, really taking care of our environment should be our priority. And during our Public Health Day, all CECs, I am sure we will support this, that we go all out with our community health promoters to mobilize the people in the household and teach them, talk about health promotion, and ensure they really understand. Sometimes we say our people fail because of lack of knowledge. And sometimes it only needs you, who is seated in this room, to transfer the knowledge you have to the person who needs it more. In terms of health promotion, it has to be you, who is at policy level, who understands why, when you sit at the assembly, why it is important to have a budget that is directed to health, a social aspect, that it will affect you directly or indirectly. So environmental health being very, very critical, that we can be able to clear our bushes in good time, drain our systems in the towns, in the markets. Waste disposal, how do we take our wastes? How do we separate? How do we dispose it? Teaching them on how to equally use dustbins, even in the marketplaces. If you walk to the airport today and checked for the wash point area, check how many people even clean their hands as they are passing through. Nobody. Because we don't see it as necessary, or we still have not felt like there is an urge to really clean our hands anymore. After all, there's no COVID. But look, what is the repercussion? Maybe that is why we will have more cholera in the near future if this is not changed. Then the final one, activity for the intended public health day, becomes the water and sanitation. And I think this is clearly what you're talking about. sanitation, water. How many water points? If you cannot afford this water bottle, what is the other way that you must? And you must take water anyway. So those who cannot afford this bottle of water, what do they do in the offices? Do they carry their bottles from home? Do they have time to even boil that water? What if you have your own water system outside the offices where hundreds and hundreds of the employees in the county government can use? Have you thought about it? You know? Because not everybody will afford this water at the end of the day. So you stay in the office. By the end of the day, you're so depressed because your blood sugar and blood pressure is shooting high, is some shooting low. So what can we do? And she talked about mental health. You know, simple things are the ones that trigger mental health issues. It is the simple things. If you're hungry, probably you can even get angry. A hungry man is an angry man. So very small things that we take for granted. Who has ever reminded you to cut your nails? So if you don't cut your nails, who reminds that young child you have in your house to cut the nails? Small things, but they mean a lot. And that is what will be about the Public Health Day. How about the same day we advocate for the open defecation eradication, so that we will all go out and we are able to speak to it. That as a PS, that is the very day you will be assured that the PS will talk about open defecation on this day. Because I will be having data from every county that if I go to the media, I'm advocating for the good things that you people are talking about from the highest level. That is how budgets come. They don't just come because you put it on paper. They come because you understand the concept and you're able to drill it to the people who don't understand. Therefore, ladies and gentlemen, we believe that everyone, regardless of their social, economic status or geographical location, should have access to essential sanitation services. I am a believer in that, and I'm totally converted to that. Therefore, thank you. We are working day and night to provide the robust, enabling environment required to guide the WASH interventions at the community level, at the bottom of the pyramid. Because if you do not think about that very person who doesn't have the knowledge you have, then that fly that is coming from my house will come to your house and will affect all of us. This has seen the recent launch of additional documents to build the capacity of the county governments and stakeholders. And this document is the National Rural Sanitation and Hygiene Protocol, which forms part of the comprehensive guidance package that includes implementation guidelines, monitoring framework, and national costed sanitation hand hygiene roadmap. By the way, we write very nice books. Don't we? Oh yes. But when they get to your desk, do you do justice to them? Because implementation is everything. We can write, sit in the boardroom, sit in this hotel, eat nice food and do all that and exchange pleasantries, exchange as much. But if we don't move to activities, we are doing nothing. We must